Hey guys, this is Chris. I'm actually just going to do a little bit of an overview if you're thinking about getting top chest surgery anytime soon. I'm getting mine done in 10 days with Dr. Beverly Fischer out in Timonium, Maryland. I actually am right now in Seattle, Washington. It's where I live, and I'm actually flying out to Pennsylvania for a couple days to stay with my fiance's family, and then we're making a drive down to Maryland for my surgery. So I just wanted to go over a little bit of what you need and what to expect before you go and get this surgery. I contacted them back in February. Betty, who is one of the nurses on staff, actually wrote a post on one of the sites that I came across and basically gave a little bit of an overview of what Dr. Fischer has done. I also saw some of the results of some of the guys who had this double incision surgery, and one that had done the periareolar approach, where they basically take your nipple off and graft it back on after everything's taken out. So I called them. They sent me all my paperwork. It came in a big binder that looks like this. It was basically 20 pieces of paperwork that I had to fill out, along with another witness who was my fiance, basically just stating that I understand that this was a permanent procedure. I had to read through a bunch of paperwork and sign all sorts of stuff and put my medical history, etc. down, because this is considered a plastic surgery procedure. They quoted me on the surgery as $7,300 out of pocket. Unfortunately, with Dr. Fischer, they do not have any in-house financing or any sort of loan that you can take out through them. So everything that I paid was completely out of pocket. I basically saved up for 9 months and paid in cash, so it's all paid for. I don't have to worry about any sort of loan. You can take a personal loan out, but I've noticed that the interest rates right now on loans are ridiculous, and considering we've been in such a bad recession, good luck getting one. So yeah, I saved up for 9 months, basically paid everything in cash a couple weeks ago, and that's a big relief for me because it's taken me so long to save up. And after everything, going out to Pennsylvania, I had to buy a ticket for that and a couple nights in a hotel, and we're staying with my fiance's parents, like I said, so we got a little bit of a break. I'm actually going to be gone for a total of 17 days. I'm leaving this Friday, and I'll be back the 19th of September, so that'll be 10 days post-op, and that'll be good because that'll give me a little bit of time to get my drains taken out and everything and make sure everything's okay before I fly back home. I've seen a couple guys get them, with Dr. Fischer, and they live on the West Coast. The financial side of it is probably the hardest thing to accomplish, as well as making sure that all your ducks are in a row before you go in. I was required to lose weight before the surgery. I've lost a total of 70 pounds. In December, I was 335 pounds. Right now, I'm weighing in at 265. You actually have to be under 275 to get it in their actual clinic. If you are over 275, and I know I've seen a couple guys who are, and that's no big deal, basically they just schedule you at the hospital and not at their clinic. The only difference is, it's going to be at the hospital, and their clinic is actually pretty nice. I've seen plenty of pictures of it, and it seems like, a little bit less hospital-like than normal hospitals. And me, I hate hospitals, so I really kicked my butt to lose a bunch of weight before the surgery. All my blood work came back fine. They do require that you have a physical 2 to 3 weeks prior. Your blood work has to be done also. They send you all this stuff in the packet that I just showed you. But you have to have it signed off by an MD. It cannot be any other sort of doctor. It has to be an MD. So I had mine done at Pacific Medical Center, which is actually in the middle of Seattle at Swedish Medical Center. They have a couple doctors on staff there who do specialize in people who are transitioning. So I forgot the name of the lady that I saw. All I know, her first name is Jessica. So for future reference for anybody in the Seattle area, check them out because they're really good and they're relatively cheap. So all my stuff came back fine. All my paperwork's in. All my blood work's in. I did have to buy a compression vest, and I bought it from contourmd.com. Basically, it was just because they didn't know if they were going to have one that was big enough for me, and I'm a bigger guy, so I just had to make sure that I got my own before going in. And basically, the one that I got was their butterfly class with a zipper up the middle and front, and then their Velcro shoulders, so you can adjust them for after surgery. And I can't tell you how much of a relief it's going to be to not wear these damn compression shirts anymore, which cost me a fortune and work okay, but it's going to be nice not having to deal with that anymore. I've actually been binding for almost 4 years now, so I'm ready for this to be over with. Other than that, the total financial burden, I guess you could say, of saving up for this surgery was around $8,000. So you can expect that's going to cost you about that much. If you do have it with another doctor like Dr. Brownstein or any other doctor, I couldn't actually find any in the Seattle area who would do it anymore, so I actually had to get it done out of state. If you can find somebody in state, it'd probably be easier just because you wouldn't have to pay as much for a flight and medical stay and all that sort of stuff, hotel, maybe a rental car or what have you. It'd probably be better. I do like Dr. Fischer's way of doing the double incision. It seems like she cuts more straight across and right under where your pectoral muscle is, so it kind of goes with your natural healing of your muscle. So I like that better than what I've seen with Dr. Brownstein, which looks like he cuts further up in the chest. So it almost looks like boob-like. I don't know. I'm not really for that. I wouldn't want my scars to look like that personally. I would rather them be straight across. So that's kind of why I chose to go with her. Plus, her results just seemed a little bit better than Dr. Brownstein's. And from what I've heard, her bedside manner is really, really great. So I'm going to check her out. I'm also going to do an updated video once I'm done with my procedure. And hopefully everything will go good. And I'll make sure to talk with you guys soon. All right.